helpyouthnow.ca.
Here to provide the COVID-19 update for Simcoe Muskoka. So at this point in time, we've had a cumulative total of 29,255 confirmed cases of COVID-19 in Simcoe Muskoka. This is up 2,573 cases since January the 12th over the past week. Today we've had 374 cases. The highest single daily case count that we've ever had was December 31st at 715. So we've actually had a reduction in our case count this week compared with last week. The reduction is actually 17%. Over the past week, it was 2,564 cases, compared with the week of January the 2nd to the 8th, which was 3,086 cases. So our incidence in the past week is 424 cases per 100,000 population per week. The week with the highest count that we had was the week of December the 26th, with 3,547 cases, which was nearly 5 times higher than the peak of the third wave in the spring going into the summer. And at that point, it was 716 cases. The province also has had a reduction by 21% over the past week, and their incidence is now 473 cases per 100,000 population, down from 580 cases per 100,000 population per week. We've had more cases in the month of January, even though we're not at the end of January, than we had at any other month in the past, including in December. So far in January, we've had 7,002 confirmed cases, compared with December's count at 6,536 cases. When we look at the cases over the last week, 14% of them were unvaccinated and 83% of them were fully vaccinated. 4% were partially vaccinated. So fully vaccinated is 2 or more doses. We've had a number of cases that had a booster or a third dose as well. So this is actually 516 cases during the past week. And when we look at hospitalizations, this is a really key point. Those who are unvaccinated are 11 times more likely to be hospitalized and 19 times more likely to be admitted to the intensive care unit and 7 times more likely to pass away compared to people who are fully vaccinated. So indeed, infections are happening among those who are fully vaccinated, including admissions to hospital in some cases, ICU admissions, and some deaths. But you're much less likely as an individual to be hospitalized, end up in the intensive care unit, or pass away if you've been fully immunized compared with if you are not. It still provides that protection against severe disease. The percent positivity has gone down over the past week, so it's now 17% compared with 20.8%. And this is an important indicator. We're less confident about our case count because of the change in the testing protocol to focus on those at highest risk. But the percent positivity remains as a reliable indicator, and having it come down is a good thing, suggestive of the potential for us to actually have some reduction in transmission in our community. I think it's a little soon to say about that for sure, but that is a positive indicator. And the province has also come down. Their percent positivity is 19.4% compared with 22.9% in the previous week. In terms of hospitalizations, 30 of our citizens are hospitalized compared with 31 a week ago, and 5 are in the intensive care unit compared with 7 in the previous week. So ongoing stability, I would say right now with regards to the hospitalization of our citizens. When we look at those who are hospitalized, they range from their teens to 90s, with 87% of those being 60 or above years of age. We have 6 cases that are associated with outbreaks in 5 institutions and 1 from another congregate setting outbreak. When we look at our hospitalized cases, 30% of them have no record of vaccination. So that's 9 of our cases. 20 of our cases are fully vaccinated with 2 or more doses, and 1 partially vaccinated. And we do have still some cases that are hospitalized that are Delta, so 3 that we know of, with 2 that have the marker for Omicron, and the others we do not know. And we're not seeing an increase in hospitalization among children or youth. When we look at how many people are hospitalized in our hospitals with COVID-19, they are actually 84 individuals, 10 of them in the actually 84 in acute care beds and 10 in intensive care beds. So that's different from the number figure, the 30 figure of citizens from Simcoe Muskoka who are hospitalized. Our citizens are hospitalized, and they can be hospitalized anywhere, versus this other figure of the 84 in acute care beds and 10 in ICU beds are people in our hospitals who could be from anywhere. So some of them are from Simcoe Muskoka, and some of them are from other jurisdictions. And we also know that 41 of these were admitted for other reasons, not admitted because of their COVID-19 infection. So they were incidental admissions. We have had a large number of people pass away over the past week. So a total of 12, and that's a very large number. It's certainly a large increase. And I would like to express my condolences to the family members for your loss, and also express concern about the number overall. So they are as follows: a woman between the ages of 65 and 79, part of an outbreak. A woman between the ages of 65 and 79 in the community living in Simcoe County. A man between the ages of 45 and 64 from Muskoka, from the community, not part of an outbreak. A man between the ages of 65 and 79 from Simcoe County in the community, not part of an outbreak. A woman 80 or more years of age from Simcoe County, not part of an outbreak. A woman between the ages of 65 and 79 from living in Simcoe County as part of one of the retirement home outbreaks. A man between the ages of 65 and 79 from Simcoe County, living in the community, not part of an outbreak. A woman 80 years of age from Muskoka as part of a long-term care facility outbreak. A man 80 or more years of age from Muskoka as part of a long-term care facility outbreak. A man 80 or more years of age from Muskoka as part of a long-term care facility outbreak. And a man 80 or more years of age from Muskoka as part of long-term care facility outbreak. The number of outbreaks that we have is also increasing compared with last week. So we presently have 96 outbreaks, up from 85 a week ago. And these are outbreaks in institutions that we follow. We aren't able to follow outbreaks in other settings in the community, such as in workplace settings. So to delve into that in a little bit more detail, 40 of these are outbreaks in congregate settings, up from 37 a week ago. So of those, 6 from shelters, 32 group homes, 2 in other types of congregate settings. We have 48 institutional outbreaks, up from 42 a week ago. So 7 are in hospitals, with, in some instances, more than 1 outbreak in a particular hospital. And 1 is in a corrections facility. We have 23 long-term care facility outbreaks and 18 retirement home outbreaks. And the names of those facilities are on our website, so I won't go through them in detail. We have 10 childcare setting outbreaks. And of these outbreaks, 27 of them have 10 or more cases, and this is up from 15 of such facilities a week ago. We are putting up the number of cases on our website for these facilities. I would note that some of them have people who are hospitalized. Muskoka Shores has had some individuals hospitalized and some that have passed away. IOF long-term care facility within the RVH unit has had a hospitalization and a death. Mill Creek Care Center has had 2 hospitalizations. Valley View Retirement Home has had 3 hospitalizations and 1 death. And Trillium Manor has had 1 death. Muskoka Landing long-term care facilities had 2 deaths. And Waypoint Horizon has had 1 hospitalization. And we've had one of these outbreaks has been confirmed to be a Delta outbreak, and 20 of them have been found to have the marker for Omicron. So very likely to be Omicron outbreaks. The others we don't know. We have 97% of our COVID cases over the past week having come back with the marker for Omicron. So Omicron has taken over almost all of the transmission happening in Simcoe, Muskoka. And that would be in keeping with what's happening across the province. With regards to immunization, we continue pursuing the last mile strategy with first and second doses for youth 12 and above. We continue with the provision of booster doses. So we're up to 47% of the population 18 and above having received a booster dose, very similar to the provincial coverage rate. And we have strong coverage for those who are 15 above, so 65% of those, and 80% of those 70 and above years of age. We continue providing vaccination at a high rate. So yesterday, 5,450 third doses or boosters were administered in Simcoe, Muskoka, including 3,636 at our mass immunization clinics. And for those who are older, those who are 70 plus, we've provided, as I said, 80% coverage for third doses. So we are doing well. We're actually doing better than the provincial rates for those that are 70 plus and those between 60 and 69 years of age. For younger populations, we do need to improve. We're not at the same level as the province. For children 5 to 11 years of age, we provided vaccination coverage first dose, 43% of this population. We have 2,307 of them are booked for their first dose appointment. And we do certainly want to encourage vaccination in all populations that are eligible, and in particular young children. We have a long way to go to get very high coverage. We are also continuing with second dose coverage for those who are eligible. That would be 8 weeks out after their first dose. We are finding that it's the younger population, children and young adults, that have the highest percent positivity. We also have a very high incidence of transmission above for those that are 80 or more years of age. And this is probably reflective of the outbreaks that we're now experiencing in our long-term care facilities and retirement homes, our congregate settings for seniors. We are conducting wastewater surveillance. That's another means of doing surveillance. And we have found that in the communities Barrie, Midland, and Orillia, that they have had very high readings for COVID-19 detection in their wastewater, and then some recent reduction, though still at a high rate in those communities. So that finding would be in keeping with the high transmission that we've seen, and might be an indication of us perhaps peaking at this time. I still believe we need more information, and I believe that we need analysis provincially about wastewater findings, and knowing that there is strong provincial interest in carrying out that kind of analysis. And our dashboard remains in red status due to the high transmission, the high percent positivity. Yellow status for health system capacity, with ICU beds, ventilators, and acute beds in yellow status for overall occupancy. And the public health system capacity being in red status, with us being challenged with the very large number of outbreaks that we're responding to. So Monday, we were to have children return to school, which I certainly support for in-person education. The weather conditions precluded that, but they were able to return to school yesterday. And so far, we've had success with that. It is very important that everybody participate in the protection of that environment, and those that are attending school with the multiple layers of protection that we always call for. So daily screening of symptomatology using a provincial screening tool, which you can access via a link on our website or directly from the province, to be conducted each day. And that is to be also conducted upon arrival at the facility for all who attend. Immunization, we have a long way to go before we get high coverage for children 5 to 11 years of age. We do have high coverage for youth, but would encourage those who haven't been vaccinated to come forward to be vaccinated. The schools are managed to cohort children and youth to help prevent transmission. Mask use in these premises, and certainly if you develop symptoms, staying home. If you're able to get tested, to be doing so, but following the guidelines around staying home, and for household members as well to stay home. And we are continuing to work closely with our school boards as we proceed with this return to school. I've talked about vaccination, and one thing I would say is we've got to the point now where we can accept walk-ins at our locations. The demand is fallen to the point where that can happen. And so we are encouraging people to book if you can, but you do have the opportunity for a drop into our clinics. Have a look at our website about the locations of our clinics and the times of operation. I would also say that with regards to schools, at the direction of the province, we are working with our school boards to identify the potential for school vaccination at the schools themselves with parental written consent. And stay tuned. We will have more information about the details of that. But in the interim and at all times, we encourage use of all the other means by which children can be vaccinated at our clinics, pharmacies, a number of the family health teams. So the Couchiching, Ontario health team, the Barrie health team, a number of pharmacies, and the GoVax bus. So more information on our website about those options for you to receive vaccination. And as I said, at our clinics, we are now allowing drop-ins as well. Okay, very important for children to be vaccinated. 2 doses has a limited ability to prevent becoming a case and therefore transmitting it to others, but certainly is protective against severe disease. Children and youth are at the lowest risk for severe disease in our population, but there are certainly instances where severe disease has happened, including the very rare instance of death that can happen. And those children that have pre-existing medical conditions would be at a higher risk of severe outcomes. So vaccination is important for them. With regards to our health stats data, we are making a change to update our case summary table as of this week starting to be at 1 o'clock to help media with your own reporting, and that the other data that we would be putting on our health stats website would be up by 2 o'clock. I've already talked about wastewater surveillance. And one thing I would say is, we do have Barrie, Midland, Orillia, and Collingwood, for which we are getting regular reports, not daily, but regular reports on their wastewater. And we are keeping that information up on our website with some interpretation of it. This is a new field for us. And so it's one indicator among other indicators that we need to take into account to get a sense as to where the transmission is going. And also, I believe that this will be useful data provincially, pooling the findings from across the province to be able to help interpret where we are at this point in time and where we're headed with transmission. So certainly that information is up on our website for people to look at as you wish. So at this point, I'd be happy to take questions.
Thank you so much for your update this afternoon, Dr. Gardner. We will now take some questions from the media. As always, we do ask that those who are participating to please limit themselves to one question and one follow-up in consideration of time. Can we start with Erica Engel from Barrie or Collingwood today? Do you have a question?
Yes, thank you. Doctor, you went over the Delta versus Omicron breakdown for hospitalizations. I'm wondering if you have that for also the recent deaths, and also if you could explain why there are cases and outbreaks where you don't know which strain it is.
So there is some lag before we get the confirmation with the province as to the type, the strain, the variant. And with the tremendous surge that we have right now, there's going to be some lag. I'm not sure how long it will be for the province to be able to get us data about the variants for all of our cases, for all of our outbreaks, and for our deaths. I don't actually have at my disposal the variants for those who passed away. I'll make further inquiries and see if I can get that information.
Thank you. And the province seems to be indicating there's an announcement coming for possible lifting of restrictions. How do you hope that will go?
I think we need to be extremely cautious at this time. There might be some early indicators that transmission is slowing, but for the province as a whole, we're still seeing the healthcare system very heavily impacted by this wave. There's still some increase in hospitalization and ICU admissions across the province. If you look at the science tables dashboard, there's an indication that those figures are still going up. So there is a lag with transmission. After transmission, you later see impacts in hospitalization and severity and death. And I believe we're in a situation right now where the healthcare system is very vulnerable. Any move away from the controls that we have in place right now could further endanger their status. I think we need to be very cautious.
Thank you very much.
You're welcome.
Shane McDonald from simco.com. Do you have a question?
Sure. I guess with you're mentioning the hospitals and they're vulnerable, and I'm just curious if you get this sort of information, or if you know if the hospital workers, healthcare workers, are having to isolate or stay away from work, if that's contributing to this issue at all. And I wonder if you know the rate at which that's happening.
Yeah, thank you for the question. I don't have a figure, but I do know that the hospitals are reporting that they are very challenged with absences associated with transmission or being contacts of cases, and that is contributing to the stress on the healthcare system. And as a health unit, we've had some of that as well affecting our own employees.
Thanks. I guess a secondary question is just, I know that not everyone has had their booster yet. So, I mean, if you're a person with 2 doses, like what kind of protection do you have against this Omicron virus?
You don't have good protection at all against transmission becoming a case. It may be in the range of 30% protection, in that range. And that is not enough to be reliable at all. I think that it's important for everybody at this time, those who've had 2 doses, certainly to use all the other protective measures as well that we usually touch on. But when it comes to severity, 2 doses can reduce severity by 70% or more of hospitalization, 90% or more of ICU admission or death. So it's very important that people get vaccines that they're able to, that they're eligible to receive. Certainly those who haven't had their first and second dose, that they do so as quickly as possible. And we do allow and encourage drop-ins for everybody, but for such people, because they're very vulnerable at this time. A 3rd dose can increase your protection. I've seen some variation in the estimates between 35 to 70% reduction in transmission or becoming a case, and about 80% reduction in hospitalization. So 3rd dose is adding further benefit.
Mary Beth Hartle from Muskoka Region, do you have a question?
I do actually, and that's basically follow up on the question I asked last week, as to whether you had a chance to find out if we could get the hospital information, the breakdowns between Simcoe and Muskoka, because I'd like Muskoka specific.
I did bring that question forward. I didn't hear an answer back. I will ask again.
Okay, thank you. That's it now. Thanks so much.
I will jot it down.
Okay, thanks.
Do you have a question for follow-up, Mary Beth?
No, I think I'm good. Thank you very much.
Okay. James Bowler from Cogeco, do you have a question?
Yeah, thank you very much. Dr. Gardner, heard this question a bit already, but I want to circle back around to it and talking about the Ford government's announcement coming regarding the possible lifting of some restrictions. Next Wednesday was going to be the cutoff date for easing these restrictions on restaurants and especially gyms. And I'm just wondering, first of all, if you have heard anything about those, what could be coming in terms of the lifting of restrictions, and also if you do support at least the lifting of some restrictions on gyms, which I've said before is a massive piece of mental health, dealing with that for people.
Yeah, thank you very much for that. as I've already indicated, I'm concerned that we still have a high level of transmission. We still have a very heavily impacted healthcare system that's quite vulnerable. We need to do what we can to keep that under control, bring that under control, and get to the point where the healthcare system is less vulnerable. I think we need to be very careful. I would not be advocating that we be moving forward right away with any kind of openings. And I would also point out that indeed physical activity is very important for people's mental health and well-being, and would advocate that people take opportunities to do so. The safest would be on your own in your home or outdoors. And if you're doing so with others and you can't be physically distanced, wear a mask while you're doing that. So by all means, be active. I know that it's very cold out. You have to be somewhat hardy to go out under those conditions. I do, but not everybody can. I would acknowledge that. So, I think people need to exercise in a way that's safe at this time. We do know that transmission has happened quite readily in gyms when they've been open before during periods of surge. So we would need to be careful about that.
And just as a follow-up in relation to that, when we were sort of looking down the barrel of the Omicron starting to make waves, you had warned that if the government it didn't move forward with its own restrictions, you would put some down here in the health unit area. Is that something that you would look at if the government moves forward, something that you feel is not viable at this time?
I think I always need to be considering if I need to do something. I don't have anything definitive in mind with regards to the matter you raised, but it's always something I need to consider.
Okay, thank you very much.
You're welcome.
Mike Arcelides from CTV Barrie, do you have a question this afternoon?
Good afternoon, Doctor. What, if anything, would you support in terms of restrictions being loosened right now?
I believe that we should continue as we are for the time being until we have more of an indication that the impact on our healthcare system, on our hospitals, is easing. And even then, we would need to be guided by recommendations and research, including from the science table, about what would be safe to begin with as a point of easing. So we need to make sure that we're not moving before our healthcare system could withstand the potential for some resurgence. And I think we need to move in a way that would have the least amount of impact as a first step.
So what would you recommend right now if the government says, okay, we're going to go back to the way we were about a month ago?
Well, I think that's a bit of a speculative question. They haven't said anything of that nature yet. I would need to wait and see what they say. I do have ongoing communication to the province about this. And so we are continuing that kind of dialogue at this point in time.
What have you heard?
I'm sorry, couldn't hear you.
Heard from the government?
I've not had anything definitive as yet.
Did you make any recommendations apart from let's stand pat here?
My recommendations are the same as what I've just indicated to you.
Is there anyone who didn't have the opportunity to ask a question this afternoon?
Hi, Kara.
Oh, hi, Mark. Yes, please go ahead. Yes, I'm sorry I missed you.
No, that's fine, thanks. Through you to Dr. Gardner. Dr. Gardner, are you at all concerned about complacency or lethargy setting in within the communities, and that there's a certain inevitability among the public of getting Omicron and thus letting down their guards as peak levels are on the horizon possibly next month?
Well, this has been a very long and difficult pandemic, very tiring and exhausting to us all. In many instances, heartbreaking to people and its impacts on their lives. people that they know who passed away, impacts on their livelihood, their recreation, their children. So I would fully acknowledge just how difficult it's been. And despite that, we know from tracking data, looking at the movement of the population following their cell phones in an aggregate way, aggregate data, that's posted on the Science Tables dashboard, that people did actually respond quite substantially when they learned of Omicron. So through the month of December, there was quite a substantial drop in people's mobility, people going out into the community and attending work and going to other venues in response to what they were learning about Omicron and the risk of Omicron. So obviously, despite people's fatigue and the difficulty of it all, they have actually responded.
So where does that leave fourth doses then?
So at this point in time, we're providing fourth doses in keeping with provincial direction and the advice of the National Advisory Committee on Immunization for seniors in congregate settings, and now have made it available for the immunosuppressed to receive as a booster dose, considering that their vaccination series is a 3-dose series. And we await further direction with regards to the potential for others to receive the fourth dose.
Okay, thanks much.
You're welcome.
We have a question from Shane McDonald asking if he could ask the vaccination status of the 12 deceased.
So let me, I always want to be protective of people's privacy. So I wouldn't be giving it as individuals, but if I tally it, I could give that for you. Seven of the 12 are fully vaccinated.
Erica, you have another question for Dr. Gardner?
Yes, thank you. Last week, Dr. Gardner, you talked about trying to gain knowledge outside of the data by talking to municipalities and different first responders. I just wondered if you've had to issue any of those exceptions you talked about, allowing maybe a snowplow driver to drive during the storm, because even though they have COVID.
So I've been approached specifically for that request by 2 municipalities. And what I've done is said, if you don't have another option, such as a redeployment of employees to do that kind of work, that I would support allowing an individual to come back to work. I would want them to choose individuals who are at lower risk among those who are off. So those are contacts who are fully vaccinated, who don't have symptoms, as opposed to people who are unvaccinated or have symptoms, being less desirable to come back to work. And they would have to come back to work in a solitary fashion. And it was specifically around the use of snowplow truck, essentially working in unison, not interacting with other individuals, and having to sanitize the vehicle when they're done, and otherwise be in isolation when they're not at work for the required duration of time.
Are there any other further questions this afternoon?
Oh, hi, Kara. Would you mind if I ask one more question?
Certainly, go ahead.
Dr. Gardner, could you go back to your tallies there of those 12 people who passed away the past week? And I think you point that there was, I believe, 5 in Muskoka, 1 in the community, and there was 4 others, if I got my math correct there. I think you said 2 at the landing, 2 at the landing, and at least 1 at the shores. And where was the other one in Muskoka?
So when I was going through the tally of those who passed away, I indicated whether they were, what municipality they were from, and whether or not they were part of a long-term care facility outbreak.
Sure.
But I didn't actually give the name of the facility when I went through that listing. And then when I went through the listing of the homes, the facilities that had the largest number of cases, people, 10 or more. In those instances, I did indicate which facilities had individuals pass away and which ones had hospitalizations.
Oh, so, but of those 12, does that sound correct? There was 5 from Muskoka and 4 in LTCs?
Well, I'll go back and have a look at the 12 and
Yep.
1, 2, 3, 4, 5 from 6 from Muskoka.
Mhm.
And are you interested in of the Muskoka individuals, those in long-term care, or are you interested in of the 12, how many are in long-term care?
Well, of the Muskoka portion there,
Of the Muskoka ones, how many were in long-term care?
yeah.
3, 4, 5. 5 of the 6 individuals from Muskoka who had passed away were
And you didn't,
within long-term care facilities.
but you didn't specify which long-term care facilities.
I didn't provide that information, no.
Okay, thanks a lot.
You're welcome.
I believe that if there's no further questions, I believe that brings us to the end of our media briefing this afternoon. Dr. Gardner, thank you so much for your update today. And I'd like to thank the members of the media for their participation. Our next planned media briefing will be Wednesday, February 2nd. Thank you so much.
Thank you. Goodbye, everybody.
Thank you.
Recording stopped.
your home for 1.2 million, $10,000 would be paid to the government.
And is that though a plan to help build affordable housing supply? And is that the plan? Is that part of what the mayor is thinking
suggesting.
Multiple
I'm not
sources?
sure, but the suggestion from the group that did that study was that it would go to affordable housing. Certainly the city's affordable housing plan, it's talking about getting funding from 2 other sources. One from the community benefits program, which, so in other words, if you build a 20-story building where only 10 stories is allowed, you have to give a certain portion to the city. And we used to be under Section 37, bonusing. So you have to give money to the city. The other portion is from our community benefit funds, benefit reserve the city has, which is money from our investment in Electra, our utilities. And those would be the 2 sources of the funding. We have not talked about using tax fund for affordable housing in Barrie.
Yeah,
Mike, you look like you have a question.
Yeah, I'm a little bit more skeptical on this in that I think, in starting to tax home equity, even if it is just that amount over $1 million, it opens that door. And then what's the next progression from there is, well, we're going to have to tax all equity on all houses across Canada. And that is one area that's sacred, I think, to Canadians, is leaving the equity in the home. That's money people put their hard work into over the years, building the equity in their homes. It's a cash cow for government if they can do it, but I think it's a third rail for any party that decides to bring that policy forward.
And that's why I think Barrie says he doesn't think it's ever going to see the light of day.
Exactly.
But
Yeah, and I agree. I think people, it's strange because I know in the States, you're allowed to deduct your mortgage payments, but you pay taxes when you sell your home. In Canada, it's reversed. We don't pay taxes when you sell your principal residence, but you don't get to deduct your mortgage payments. It's kind of a different system. I'm not sure which is better.
So Barrie, you've been doing this a while. You're in your 21st year, 22nd year?
Yes.
21st?
Entering 22nd, I got to tell you.
Okay, and so obviously you've seen a lot of change, though. You've seen the city go through a lot of cycles. I wanted to give you an opportunity to sort of, give us a summary on where you are, what you're seeing, and what you're anticipating, because you've been through a cycle once or twice before in the city.
Yeah, I mean, it's always exciting. I think it's exciting. I mean, just watching developments around Barrie, seeing new plans for things, it is exciting. It always takes longer in municipal politics to do things than you think it's going to take. You know, it's 22 years. There's been projects that have been on the works for 22 years. You haven't asked me about the Allendale train station, thank God. But I always get asked about that. What's going on? And that's been 22 years ago. We're talking about redeveloping the Allendale train station. We're still talking about it. I mean, it takes so long to get things done in municipal government. And I mean, sometimes people say it's red tape. And it's partly red tape. It's also because there's a process we have to follow. We can't just go ahead and do things. We have to follow a process. And that's the frustrating thing about it. But I mean, go back to your question. It's, yeah, I guess I kind of learned to roll with the punches. And, things have to take a long time to happen. And you sort of take the victories, small victories when you can get them. And, the economy gets better, it gets worse. We've seen housing booms, we've seen housing stall. And in the end, it'll always work out, I hope.
Some good insights and some good advice for residents and for a few councillors too, in those words, Barry. And we thank you very much for all your insights today and for all your information. It's always great to have you on the show, and we hope we do get to speak with you at a later point on Hitting Home with Mike and Arif, and thank you very much. We'll see you again soon.
What kind of show do you want to see on Rogers TV? What interests you? Log on to rogerstv.com, fill out a show proposal, and tell us about your segment idea. We want to know what you want to see. Rogers TV, only on Rogers.
Leonard Thompson, 13 years old, diabetes mellitus, 65 pounds.
Starve the child to let them live? The treatment's as cruel as the disease. It's a death sentence.
Dr. Banting, this could be it. He's the first to receive this trial. But will it save him?
It's not pure enough. So we try again. And again. And again.
Before the discovery of insulin, diabetes was a death sentence. Banting, Best, Collip, and MacLeod's breakthrough has saved millions of lives. Leonard Thompson's was the first.
Welcome back to Hitting Home with Mike and Arif. We just wrapped up with Deputy Mayor Barry Ward, and that was a great show, and Barry always has some great insights, Arif. And one of the takeaways there for me was the amount of development that we are seeing and we're slated to see in the years ahead here and even the months ahead for the city of Barrie. And one of the things you touched on with that is we do tend to see resistance, and that's commonplace. And I mean, if a big project is coming up at the end of my street, it's quite possible I might have something to say about that. So I'm just curious about your thoughts. You did your time on City Council in the past. You've seen those deputations come forward from people when there is a new project. Where ideally should a city council or a city staff, not city staff, but a city council in general be positioning itself there?
Yeah, well, great question, and a lot to get out, obviously, there. Listen, Barry is a great guest, but he's also a great counselor. He's a great politician.
Yes.
21 years of wisdom there. He's one of the more progressive people. He's very steady. You can always count on him. He doesn't get phased. He's been through the cycles.
Yeah.
And I think one of the things that is a takeaway for me is that, and I learned this from him, probably more so than any other counselor, is that it's who are you serving? Who are you responsible to?
Yes.
And it's not about getting emotional. At the same time, don't mistake that for not being empathetic.
Exactly.
The city is changing. The city is growing. We're not Barrie of 1980s. We're not even Barrie of 2000 anymore.
No.
We're in 2021, 22 right now. And we do have to grow to meet future demand. There's that balance. He called it compromise. I personally don't like the word. But it's about finding balance of what is best for the city, what are our needs, where do we need to go, which is why I touched on the fact that we keep saying out of one side of our mouth, we need more housing stock, we need housing availability, we need housing affordability. Well, if we don't actually let it be built, then that's not going to happen. If we want a walkable community, then we have to make it possible to be walked, which means, as Barry pointed out, more density equals more people likely using public transit, therefore more opportunity to invest in public transit or bike lanes and walkable neighborhoods, et cetera. And if you build the community where people congregate, there's likely going to be shops and services that are going to support that neighborhood. So I think Barry's absolutely right on track in the sense that, he has to pay attention to what we need going forward. And so he'll negotiate, or council will work with the developer to say, you're not going to get everything you want, but you're going to get some of what you want, or maybe most of what you want, but, right? And then to the neighbors who are there, it's, listen, things are changing, but we hear you and we'll,
and growth does look different. I think back to, I moved back to Barrie in 2000. At that time, we were in the midst of a growth wave here in Barrie. It was different in the sense there was a lot of large tracts of land, big subdivisions, single detached homes on 40, 50-foot lots. That was the norm for development. And it really did not ruffle the feathers of neighbors right next door. There's a difference between that subdivision on that vacant tract of former farmland on the edge of town and that little tract of land that may have had 2 or 3 older houses taken down, and now you're seeing four stories going up there. But with that difference as well is, I think we've learned a lot over time in how to build the infrastructure, build for walkable streets, as you say, and bike paths and parks. We're doing things smarter now than we were there. Often those projects were built back then without that additional infrastructure being seen for years, if ever. So
yeah, well, one of the other areas where Barry is quite correct, and it's funny because he was often referred to as the sage voice on council. If you look at some of the challenges that we face, they are based in infrastructure. They're based on capital. They're based on unsustainable levels of deficit and debt. Two very different words, but both with D and both not great. And that is, I mean, there's good investment that you pay off over time, but there's also operating in an upside down fashion. And to constantly build on the outskirts of town or on the edge of town, just forever build these single detached homes, it's not sustainable. Because the cost to replace that infrastructure in 20 years or 50 years is not sustainable. So if we can have a healthy mix of multi-unit developments in the inner core, that'll allow to sort of get better use of our dollars, if you will. The other thing is, though, that the thing that I brought up last year, and I know we talked about it, was, well, how does COVID change that? Because now do we run into a challenge where nobody wants to live in communal housing, in a communal setting where we share elevators? And one has to believe that we're learning something about that in terms of filtration and ventilation, and how are we going to build multi-unit homes that will still address healthy airspace and living spaces, et cetera. So I think we're going to see more of that. We will over the next 10 years.
And I think with that, in existing infrastructure, existing homes within Barrie, given the price point of homes now, we are going to see more of a shift to people wanting to have that second suite and needing that second suite to have a secondary source of income to help offset the cost of the house. With that, you'll see those second suite. You're also going to, I think, see the return of what we've seen for centuries or for decades in Europe, and that is blended families, different generations living in the same household. That's not the norm in North America, but I think you watch over time, cost will be the pressure point for that. That will see us seeing more multi-generational families in the same house.
I'll pose a response to that. And what is the norm of a household in North America as we continue to see more immigration and more people come to Canada, and we see more blended families? And blended doesn't necessarily mean of multiple marriages, but it also means of multiple ethnicities living together, you might see the return of that lifestyle. The other thing is that while you might see second suites for supporting, in terms of having a tenant and supporting the cost of the mortgage or carrying the cost of the home, you might also see it from keeping people living at home, aging in place, as it were.
There's the term
where
we hear
you're
more and more, yes, age in place.
Yeah, where you're not necessarily going to put mom or dad into long-term care at maybe $2,000 to $4,000 to $5,000 per month, but you save that outlay of money and you keep it in the home. You know, you might be bringing a PSW in for a few hours a day.
Or a family member, or multiple seniors.
So as Mike, you brought in the initial question of this segment, which is, we can't please everybody, and we're seeing a lot of concern raised by neighbors when they see change. The reality is change is inevitable. It is the only constant. It's never easy. All of these cliches from all the self-help books that you can possibly read, but we are going to continue to see change.
And we all need to adjust our expectations. Yes, for sure.
So predictions for you in terms of housing starts and turnovers? I mean, right now the inventory is really tight.
The inventory is tight. I think it's going to be another busy year this year, and I think you're, unfortunately or fortunately, whichever side of that transaction you're on, there will be competing offers. But I think the turning point for that is going to come at some point this year, predictably mid to late summer, when we do start to see interest rates go up. I think that will have a legitimate effect. I don't think it's going to stop the market. I don't think it's going to burst the bubble, as the media likes to say, but it's going to have a calming effect. And what I would like to see is more inventory, because I think it's the shortage of inventory, not just the excess number of buyers per se, but the inventory shortages that we have of homes for sale that is really making things difficult.
Mike, 21 months ago when I guess it's 21, almost 22 months ago when we started this pandemic, we started sort of pontificating and hypothesizing on what was going to happen. And one thing we knew for sure was that the borders were going to be closed and people weren't going to be taking their trips south of the border to visit a theme park or go to Europe or go on a cruise. And so we said, well, you know what? Why not invest in your home? Why not do a renovation? Why not take that money that you were going to spend outside and invest it in your home? Build your equity. Jump now while the prices are still good. Build a backyard oasis.
We said that?
A staycation. We did, actually.
And they
listened. You go back, and it's amazing. The entire world listened. But you know what? It seems to me like we had our finger on the pulse there, and I'm glad that we did. Now, 2 years later, for some of us, renovations are done. Not all of us. Renovations are done.
We've had enough of them.
It's going to be a while before you might renovate again. So I'm glad that outlay of money is theoretically, for many, done. I think we are going to have to address household debt. I think we are going to have to address credit card debt and how we're going to live within our means. But to temper it, I think some of our spending's done.
Yes.
For some of us, the spending's done, and certainly with the price of materials the way they are, spending should be done. What do I predict in terms of that? I definitely think that people are going to reconsider their habits. I think they are going to appreciate what they have, but I am excited to see what happens next from the corporate side of things in terms of, does Barrie truly remain a place of interest for outside investment? Does Barrie look like a place where employers will start to invest and set up shop, maybe because land prices are cheaper still, theoretically, they have gone up. But I'm curious about how that's going to play. Does Barrie see a new wave of corporate investment? 30 seconds on your thoughts on that.
Short answer to that is yes, and longer answer is I think we have a whole show we can talk about that, and we'll bring in a good guest on that, because I think Barrie is going to be on the radar for business and for growth, consumer and commercial growth going forward for sure.
Well, Mike, I enjoy this new format. I hope you all at home enjoy this new format. It gave us more time to really unpack some thoughts and ideas and spend some more time with our guests. So I want to thank you for joining us again in 2022 on Hitting Home with Mike and Arv, and we'll see you next week.
Call the Rogers TV viewer response line, email us, or connect with us on social media.
I'm Mallory, and I was walking home one night when an impaired driver hit me. He had been overserved in 2 bars before getting behind the wheel. If the servers would have called him a cab instead of serving him more alcohol, my life would be the same as what it used to be. I think servers play the biggest role in keeping us safe because it's up to them what state the person's in when they leave. Refusing service isn't personal, it's the law.
We are here today at Ground Zero, the office, and now I can call the museum of Mr. John Durlis. Welcome to the show, John.
Thank you.
Great to have you on.
My pleasure.
So, as was growing up, was music part of your family at all, or were you surrounded with it as a child?
Way back when I was a child, my brother and I, and my sister for that fact, were interested in music, and our dad bought us guitars, and my sister was playing the accordion, which was a step to be a pianist. So we started with acoustic guitar lessons, and we were interested in that for quite some time until we got to electric guitar. Made my dad buy everything, and then the squirrel ran by, we lost interest, and didn't continue on. Didn't continue on with the guitar lessons, but it was comical because it was just soon after my dad invested in all the electric gear. So we feel a little bad about that, but it did instill the love for music.
Yeah. So how did you get from enjoying music, loving music, to getting into the whole promoting, not to jump too far, but just the idea, concept of getting into the promoting business?
Well, I think it touched me when I was on a social committee during high school, and I ended up planning and implementing the dances, the school dances, and that was all school-based. It was fun. And again, it triggered a love for music to me. And while I was still in high school, I then tried my first paid event, which was at the April Lanes in Scarborough, and created a singles party. And we sold admission, and then the bug caught. It just, people were interested. We created a concept. Probably used Letraset for the poster and the tickets.
Yeah, they'll copy and paste.
Yeah. I actually have a ticket on the wall just to show you from Letraset. But and it went on from there. From that point on, I started in the hospitality industry while in high school. The Daybreak restaurants and nightclubs. There was 2 locations at Kennedy and Finch and Leslie and Finch, and I worked there as bartender, waiter, cook, went up the ranks to manager, and then I was manager of both locations, and the proprietor there was Gino Carlaveras, and him and I then opened up Goodfellas at a later time in Barrie. So, but while I was there, I decided to check out a visit with my cousin Carl, who owned the Limelight. So Carl was my cousin, and I brought to him some promotional ideas, and he then introduced me to Joe Iacobaccio, which we hit it off, and I became Joe's general manager. That would have been 1988. And we had 4 years of good times and a lot of music, a lot of heartful music.
That was a great era in Barrie at that time. The Goodfellas, Rowan's, the Limelight, the Wellington American, going back, not the Wellington American, but there was so many bands bars at that time. And can we go back though a little bit and talk a little bit about after you had left high school? At what point did the docks all come into play with all that?
Okay, so the docks, that was a very interesting period of my life, almost a decade. So I was at Goodfellas at that time as the proprietor, and I had a visit from Jerry Sprackman and Rob Gilroy. Unfortunately, both of them have passed in this last year. But they basically recognized that I was promoting strongly and had a strong operation there with a lot of bands, a lot of theme nights, and they scouted me out, made me an offer, pulled me from Goodfellas to be the marketing director. Well, year one I was operations, and then year two to about 8 years later was as the director of marketing of the Docks Entertainment Complex, and that was a hell of an experience. I have a couple of highlights I should explain to you about, or talk to you about.
Yeah, I'd love to hear what was going on at that time at the Docks.
Number one, it would be Victoria Day weekend, and all of a sudden it'd be Labor Day weekend. It was so packed of events and themes, and it was just, it was a large venue, 10,000 people. Well, as a matter of fact, this is the Docks right here.
Oh yeah,
yeah.
Very cool.
So this is the club here. There's the patio, the recreational golf, drive-in theater, all under the marketing umbrella from was under my control at that time, with a big team, not just me. But anyways, it
was a big undertaking.
It was a big undertaking and quite a challenge. It basically gave me the connections I have today, and working with all the agencies and the marketing elements, the sophistication of how to break down impressions and sell sponsorship, all derived from the Docks Entertainment Complex.
So we'll rewind and get back up to the day with Goodfellas and Rouen and Continental as well.
Yeah,
that was a pretty good party time at that place as well.
While we were at Goodfellas, I had 2 concerts at the Continental, and it was we named it Huronia Concert Hall.
Yes.
So we did Honeymoon Suite and The Game there. Scott Hunter is the band The Game, which is, I think it's just Hunter now. He opened up for Honeymoon Suite, Johnny D, Derry Green, good friends of mine. And then we did Triumph, second show there. And both went off. It was a hell of an experience, but yeah, so 2 shows there, and then from there I went into the Rocks while I was at Goodfellas. So way back then I became the promoter of the Rocks venue, which transitioned to many names and so forth. But over the last, for the majority of that period, I was the promoter on record, bringing in the most amount of shows into that building. And it went back and forth from there to the Ranch a couple of times with some transitions of ownership. And now back working with the Ranch because of, unfortunately, that building, which the latest company was Mavericks, is a victim of COVID and will not be reopening under that name. But so working on things now with Sadlin Arena, Waterfront Festival, and the Ranch to see what sticks. A lot of irons in the fire right now.
Good way of wording it. Let's see what sticks.
Yeah, I mean, it's a tough time being in the tail end of a pandemic that they're saying may never end, right? So you really got to do things wisely. And I'm not sure if I should be sitting back, keeping my powder dry right now, or which is very hard for me to do, so I'm already, I've got offers in already on several significant large bands, but 2022 shows that need a home and may find themselves in a venue, in an arena, or on a waterfront festival, and I'm persevering towards that, keep me motivated, and I always have the love of music, and I always like to help the indie scene move along as well. I started that Breakout Sound program that I'd like to get back to that and bring the indie bands to the large stage.
One thing I was going to applaud to you is that the fact that you do support the local bands quite a bit. You always use the locals as openers, which I've experienced. And I think being a part of that whole community and offering means a lot to some of these young bands. Do you get feedback from a lot of the bands, kind of saying thank you, or do you get feedback from the the opening acts or sort of the original acts commenting on some of the opening local acts?
It's not easy to get them on to the bigger stages because the bigger acts are part of management companies that wish their developmental bands to put on that show. So I'm always fighting to give them that spot, and it's appreciated certainly when I win that fight, and now I build it right into my offers, and I say that that's an integral part of the offers because we have this music program, breakout sound. So bands are appreciative. I'd like to get it to the point where it really makes a difference in their careers, not just the experience of on a bigger stage, which gives them airtime on Rock 95 or studio time, a lot of digital assets from the show with a big crowd, that help them move along all their social channels to the next level. But I'd like to give them the opportunity of what the agents and managements are always trying to do, and that is to connect them with a North American-wide tour, or at least Canadian tour, and make that part of the prize package, or the investment, the return on their investment for working into the program.
Yeah. Sort of on the same wavelength too, as far as community support and being active. You have a great relationship with community, with Rock 95, and as well as I understand recently you also donated a bunch of memorabilia as well. Is it really important for you to be part of the community and have this relationship with other media, et cetera?
Yes. I believe music is from the heart, and your heart tells you what the right thing is to do. And when people need help, you try to use music to give them that help. And over the span of a 35-year career, more so in the first 3 quarters, there was significant donations to whether it's the toy drive or Radio for Cardiology, Jammin' for Jamie, Canadian Mental Health Association. It goes on, and there's hundreds of thousands of dollars that Impact Live has contributed towards a wide spectrum of charities or service clubs, mostly in the previous years and the first half of my career. Because as I get older, the earning years become less, and I have to start thinking, that we have to earn, right? And it's not getting easier; it's getting harder as far as the viability is concerned. So, still trying to figure that out as we go, move along, but it's like a work in progress.
Yeah. When you developed Ticket Break, was part of that talking about pinching and saving a penny here and there, was part of the concept of Ticket Break, was it also to relieve the middleman and you kind of taking that role of, or I remember at that time too, there was a lot of screw ups, and there was people were buying tickets in bulk, and there was all kinds of weird
the industry,
things. Yeah,
fraud and so forth.
And, yeah.
Well, Ticket Break was a product of my experience at the docks. We were engaged with Ticketmaster at that time. At that time, there was only Ticketmaster, Ticket Pro, Audience View, and then I created Ticket Break with a team of technical team I had. It wasn't just me because I'm not a programmer by any means. But so around 2004, I did an analysis on the Ticketmaster scenario, and they were making a lot of money on back then the bank rate was 4.9%. They're probably paying $1%. I hope they don't get mad at me for seeing this, but disclosing this information. So I did the math. I had technical people in working with me at that time. We created a partnership and we developed Ticket Break, and that was doing quite well at some point through 2004 to about 2008, and then the world started crashing in with car companies, banks were all starting to crumble during that recession. And we were lucky enough to sell it to Maple Music, who then sold it to Ticketfly, who then sold to Eventbrite. And I'm still engaged in the ticketing, but I use it as sort of my agency service. So,
gotcha.
But it was tough after 2009. It was quite a big investment in chasing a big dollars every month to fill a hole that we're lucky enough to be able to pass on the client base and technology to other people who had deeper pockets.
Yes, yes,
yeah.
I look around these walls, and the names of some of these bands that Wilcox, Thornley, Glorious Sons, Misfits. I can go on and on. How do you, without giving away your secrets, what's your decision on trying to have a band come to the city and know that it's gonna fly? Because Barrie is an interesting market. It loves its chicken wings and it loves its rock and roll. Is that part of your?
Well, it's not an easy. I mean, you gamble.
Yeah,
everything is a gamble, but you do your research, you do your diligence every time. Usually, agents present a tour that is happening, and after being in the business for 35 years, that I'm sort of the guy they call for Barrie, and we do an analysis. We run the numbers. We look at their assets. We look at their YouTube numbers. We look at their social media channels. All the numbers. See what pull we can get from them in our community, and we run the numbers. And most of the time, we're